Hello, everybody. This is me, Dr. Tariq, and I'll be sharing today my presentation, which is related to the strengthening of healthcare system through improved healthcare waste management and staff education and safety precautions. So the learning objectives of this presentation, it is at the end of the presentation, the audience and the viewers will know about what is healthcare waste management, and then what is the good healthcare waste management, what's the responsibility of the team, what's the responsibility of the clinical team, what's the responsibilities of the sanitary team, what's the responsibility of the nursing team, and then how we can protect ourselves and others from the harmful effects of waste. And then at the end, the last but not the least, to know about the standard precautions. Uh, Now, healthcare system. So it can be defined as the increasing healthcare needs of people in different countries had led to increase in the number of hospital, clinics, laboratories, health centers, clinics, dental clinic, and other center, which in turn has increased the amount medical waste. Like as a result of the provision of healthcare, it's resulted in the generations of medical waste in form of different like soft waste, sharp waste, organic waste, etc. And then, like a developing country like Pakistan is faces a significant burden of blood-borne infection, including hepatitis B, hepatitis C, and human immunodeficiency virus, largely driven by inadequate healthcare waste management practices and unsafe injection theory. Like if we see, Pakistan is one of the country where blood-borne infection like hepatitis B, C, and HIV/AIDS is high prevalence is there, and then like if we see the reason, so healthcare waste is one of the reason. Like it contributes a lot because there are unsafe practices like reusing of needles and lack of sterilization, proper sterilizations, especially in the dental clinics and in the surgery departments. Then here was and there are people who are collecting the waste, and then there are people who are dealing with the waste treatment. So these are exposed to the harmful effects of this healthcare waste. Now, healthcare waste. So before going to the what healthcare waste, first we need to know what is exactly a waste. So anything which is generated from the human activities and which is useless, discarded, is considered as waste. And then healthcare waste is the type of waste which are generated from healthcare facilities or healthcare structure, and is categorized as hazardous waste, is called as healthcare waste. Hazardous waste is any type of or combination of waste that possesses substantial danger now or in future to human, plant, animal life, and which therefore can't be handled or disposed of without special precaution. So, healthcare waste has the potential to harm us either in presently or maybe in future. Presently can be, like it can give us infection in future. Like if we are doing open burning, so it can harm us in future in form of, like soil contamination, air contamination, water contamination. Now, example of medical waste include syringes with needle, gloves, dressing, infusion bags, infusion packaging, human tissues, organ, food tube, lab waste, expired drugs, etc. Why it's important to manage waste? So there are reasons why it's important, and the first one is because it's hazard to our health and the environment. Waste can harm us directly. Waste can harm our environment. Waste can harm our air, our ecosystem, and it can attract pests just like rat, flies, dogs, goats. So if there is scattered waste, these things will come. And then waste can transmit diseases like hepatitis, which is a blood-borne infection, and HIV. Cholera is also, like can cause because of the fecal material. And then TB. Waste can also cause injury, cuts, burns. Like if there is needle, it can perforate our skin. If there is broken glass, it can cut us. And then another reason why it's important to manage waste, it looks offensive, like looks bad due to their bad smells, and also the aesthetic point of view. It's not look good if it is scattered in the environment. Contaminate water, like if the waste, like it can goes to the water bodies, it can leak to the water stream, and the similar way it also can contaminate the soil. Now, disease transmission, how waste can, like the different pathways of the disease transmission. So one is hand to mouth transmission, like if we touch a waste, like let's say pickle materials, and we eat something, so we transmitted the infections by hands to mouth transmissions. And then needle stick injuries, needle, it can cause injuries by direct prick or by the use of medical disposable, and it can cause hepatitis B, C, and HIV, which are considered as blood-borne infections. And flies, diarrheal diseases, this is like one of the root flies, which can, like transport the germs of the diseases. The combination of soil and water with chemicals are tetanus, polio, hepatitis A, cholera, typhoid. So this is also, like waste can contaminate our soil environment, water environment with chemicals as medicines, and these things is made of various chemicals, and when it's discharged to the environment, it can cause various problems. And various health issues, it's included tetanus, polio, hepatitis A, cholera, typhoid, fever, dysentery, etc. Now, we have discussed about the various infections and the root pathways through which these infections causing. Now, who is at risk? So, if you see this photo is, like from one of the place, and I myself taken this photo, where you can see how the people are exposed to the hazardous impact of waste. You can see, like the past. People is, like this is mixed medical waste, and it has, like needles, it has blood, it has chemicals, so they can, like it can prick them, it can give them infection directly. Another the medical staff, they are also at risk because the medical staff is the one, like who are the first hand. One after their collection, the medical staff need to throw it to their designated container, so it can, like infect, it can give them break. This is one. Then patient and visitor. The patients who are admitted in the hospital, they can get break, and then the people who are visiting in the hospital, they can also get break. And the cleaners who are working with the waste collections, they can also get the infections. Worst person, the person who are collecting the waste or who are disposing the waste can is also at risk. And then the surrounding population. If you see the photos, these are the people. So one is directly it's affecting their health by like infection, and then another is like when these things go to the ear, it's contaminate the air environment, and the surrounding community can be affected. Like now you can see like how the people like they are at risk. And another good healthcare waste management, the purpose is to make this waste non-infectious plus inaccessible to the population. Non-infectious, like if we segregate the waste, if we collect the waste, if we dispose the waste properly, it will become like its infection capability is finished. Like we incinerate the needle, we disinfect the needle, we sterilize the needles or the surgical instruments, so it will not become remain an infectious or source of infection. Another is like if we follow this cycle, we managed all the things, we proper segregation, proper collection, proper transportation, proper disposal. So the people will not come to do the illegal collection, do the illegal trade of the waste, and this thing, like the environment can remain safe as well as the human health, being human beings. Now, what are the steps in a good healthcare investment? So you can see the first step is the waste segregation. The healthcare waste can be segregated into sharp, burnable, organic. Sharp, like needle, broken glass, blade, etc. Burnable, anything which can be burned easily is considered as burnable waste, or soft waste like plastic, paper. Organic is placenta, foods, residues, etc. And then the second step is the storage. The third is the treatment. The last one is the disposal. So these are the various stages of waste management. Now, the segregation is the responsibility of medical staff, laboratory staff, waste, and then storage is the waste manager job, and then treatment is also, like the person responsible for the disposal and incineration, and then also it's the responsibility of waste manager. Now, this is, like our example of for waste management. You can see, and this is, like a real photo. It's not edited or AI generated photo, but it's a real photo, and it's also from our country. You can say now sharp waste. So we already discussed what included in the sharp waste, what's included in the soft waste. You can see some of the photos as example, and then organic waste. Now like there are different divisions, different organization and institutions has made some, like this is called the color coding. So some made it based on the nature of waste, some made, but this is different from context. And so we'll just give one example, like the sharp waste should go to the green bucket, and like needle, blades, and fuel, broken glass. Then burnable waste, like soft waste, plastic, it should resin, gloves, packaging, syringe, needle, it will go to the blue bucket. And then organic waste, it should go to the red bucket, like placenta, body fluids, organ, human tissue, etc. So these are, like the color coding is just to categorize the waste, just to make this, just to facilitate its treatment. Like if it is segregated in these container according to its color coding, it's easy to be transported, it's easy to be disposed. And then for the needle, we can also use, like this needle container. And then what are the treatment options available? So there are several methods that have been successful in the treatment of healthcare waste. One is incineration, which means to detoxify for sharp and burnable waste. Landfill, we can also do the landfilling for sharp waste, composting for organic waste, and operation and maintenance. Like if you use a small scale incinerator, we need to do a proper maintenance. Operator must be trained for the incinerator in use. The person who is operating the incinerator, he should know about its maintenance, about its how it's functioning, its fuel. This avoid accident, injuries, and damages. Protection equipment during operation and maintenance is required. Heat-resistant gloves and boots, masks, goggles, cloths that cover the body and helmet. It is important that the incinerator reaches the optimal temperature for an optimal performance. If there are certain temperature which can, like kill the pathogens, which can disinfect, like the waste. So it should reach to their temperature. Regular inspection and enlarge the life cycle to avoid damages and necessary. Now, applicability. This kind of incinerator, it is applicable in every location for almost all kind of waste. It's especially avoid open burning. If there is incineration, it will avoid open burning. If there is no facility, the people will go for the option of open burning, which is more harmful and, like dangerous. And once understand, so we can, like get rid of the waste piles, which is, like scattered in the backyard and in the water channels everywhere. Now, recommendations. So, what's the recommendations? Introduction of regulation for proper waste management in every single healthcare is, like if we are talking about our context, so we need to have a proper regulations for the healthcare waste management. It's very important. What should be done at the primary healthcare? What should be done at the secondary healthcare? What should be done at tertiary level? What kind of incinerator? What kind of facilities need to be done? Develop comprehensive healthcare waste management policies and outline the roles, responsibility. What is the role of the nursing staff? What is the role of the doctors? What is the role of the sanitary staff? We need to, formulate that. And then conduct regular risk assessment to identify potential hazard and healthcare waste management processes and implement controls to mitigate the risk. Implement a system for monitoring and auditing healthcare waste management practices to ensure adherence to policies and regulation. Provide training to and ongoing education for healthcare staff. This is, like a continuous process. There are new staff, so training should be conducted to make them aware about the protocols and the process, and then implement waste minimization strategy to reduce the overall volume of healthcare waste generated. Foster culture of sustainability within the healthcare facility by promoting recycling using, here are, some people call it 3 R's, some people 5 R's: recycling, reuse, rethink. So many, there are many thoughts about it, and environmental. Establish clear communication channel for reporting incident. If there is an incident, if there is a needle prick, so the people should know where they should go for the first aid. What's the procedure they should follow up the accident or the incident. Periodically review and evaluate waste management policies and procedures. So these are the recommendations which we can. With this, we can, prepare a proper healthcare waste management system. Now, supervision. So, for the in department wise, proper supervision is needed. Who is support to provide the logistic support, the label, and the training. So, it's a shared teamwork. And then waste manager is waste collector is a person responsible according to a schedule to transport the waste from the department to the waste zone. Now, protection. Like we discussed about the waste management, now it's the time to know how we can protect ourselves and our patients and others by following some standard precaution. So we need to follow these precautions like blood and body fluids from every patient are hand. We need to deal with the blood in a way like we think it's always has infections. So we need to wear gloves, wear masks, goggles to prevent infections. Either if the patient is screened or unscreened, still we need to consider this is, like always has infectious. Protecting yourself means protecting your colleagues, patients, and their visitors. If we are taking care of the waste, taking care of the infection, it means we are not only protect ourselves but also protect our patient or visitor, community people from cross contamination. And then vaccination, it's very important to have a vaccine for all the stops, especially hepatitis B vaccine. And now personal protection. When we are practicing, this is for the paramedical staff. When they are practicing, they should never recap the used needle. Sometime after the injection, the people they are trying to put the caps, put the caps. So this is it should be avoided. It's not encouraged to do this. And then if there is a waste container, we should never put our hands into the waste container because it can harm us. Immediately dispose. Like if we have waste in our hands, we should not keep it on the table. We should not wait for someone to come and take it. Immediately we should throw it. We should take it to the designated container. If the safety box for the needle or if the waste container it's full, we should transport it to the waste zone. Should never overfill it. And if we are dealing with some medical supplies, we need to wear gloves, wear boots, overall gloves, and collecting and disposing the waste. So these are the personal protection. And then use educate tool to collect the waste and proper hand or hygiene. Like even wearing gloves, still we need to wash our hands because there is nothing, like which can replace hand washing. Now, in case if we need if we got a needle break injury, what we will do? So first step is we need to let the wound bleed without squeezing. We don't need to squeeze. Some of the medical professionals or some of the people when they have this needle prick immediately they start bleeding, but this is something if not